I'm Dr. Rena Loeb, a physician specialized in urology and men's health, with over 2 decades dedicated to understanding how the body, the mind, and hormones work together to shape vitality. My mission on this channel is simple: to help men and women uncover the truth about their health without fear, without shame, and without confusion. Here, we talk openly about the science behind the body's most intimate changes, from hormones and metabolism to prostate, bladder, and sexual health. My goal is to give you clarity, confidence, and the knowledge you need to take control of your well-being, not just for today, but for the years ahead. If you're new here, welcome. You're in a safe, science-based space where curiosity is encouraged and every question matters. And if you've been following my work, thank you for your trust and for being part of this growing community that believes in prevention, balance, and honest medicine. So, let's begin today's conversation, and as always, thank you for being here. Have you noticed that the amount of semen you produce has decreased over time? Maybe it's not something you talk about openly, but you've seen the change. And you wonder, is this normal? Or is it my body trying to tell me something deeper? Today, we're going to talk about semen volume, what it truly reflects about your body, your hormones, your metabolism, and your overall health as a man. Because contrary to what many believe, changes in semen production are not just a matter of fertility or sexual function. They're often a mirror of your metabolic, hormonal, and vascular health, all systems that age together and can fail together if we ignore their early signs. In young, healthy men, the average semen volume per ejaculation ranges from 1.5 to 5 milliliters, about a teaspoon. But in the last few decades, studies have shown a consistent and alarming decline, not only in semen volume, but also in sperm count and motility across the world. In 2017, a major meta-analysis published in Human Reproduction Update reviewed more than 40 years of data from 185 studies. It found that sperm counts among men in Western countries had dropped by over 50% since the 1970s. That's not just about fertility, it's about what's happening inside men's bodies at a systemic level. Why is this happening? Let's explore. The production of semen depends on a precise hormonal orchestra involving testosterone, FSH, LH, and even thyroid hormones. Testosterone, in particular, is crucial not only for sperm production, but for the maintenance of the accessory glands, the seminal vesicles and prostate, that produce most of the seminal fluid. So when testosterone levels decline, as they naturally do with age or metabolic dysfunction, semen volume often decreases too. Low semen volume may actually be one of the first visible signs of low testosterone, long before fatigue, muscle loss, or low libido appear. Low testosterone itself can result from insulin resistance, chronic stress, excess body fat, or exposure to endocrine-disrupting chemicals like BPA and phthalates found in plastics. So when semen production changes, it's rarely an isolated problem. It's a sign of a whole-body hormonal imbalance. About 70% of semen volume comes from the seminal vesicles and another 25% from the prostate gland. The sperm itself, produced in the testicles, makes up less than 5% of the total. That means any change affecting the prostate or seminal vesicles, inflammation, infection, or congestion, can have a major effect on the quantity of semen released. One of the most common causes is prostatitis or inflammation of the prostate. It can be bacterial, but often it's not. It can result from chronic pelvic tension, poor circulation, or even prolonged sitting. In other cases, the issue may be benign prostatic enlargement, common after age 50. As the gland grows, it can compress or obstruct the ejaculatory ducts, reducing the amount of fluid that can be expelled. So a lower semen volume can sometimes be a subtle early sign of prostate congestion or dysfunction, even before urinary symptoms appear. Another overlooked factor is hydration. Semen is about 90% water, and the body prioritizes vital organs first. If you're chronically dehydrated, reproductive fluid production is one of the first areas affected. Beyond water, nutrition plays a vital role. Zinc, selenium, vitamin C, and omega-3 fatty acids are critical for producing healthy seminal fluid and sperm. Zinc, especially, is concentrated in the prostate. When deficient, which is common in men with poor diets or gut absorption issues, both semen volume and quality decline. Then we have alcohol, nicotine, and sugar, substances that reduce testosterone, increase oxidative stress, and directly damage sperm DNA. Every drink, cigarette, or sugar spike silently impacts reproductive health, just as it does cardiovascular health. A question many patients ask is, Dr. Loeb, could a lower semen volume just mean I'm ejaculating too often? The short answer is yes, frequency matters. After ejaculation, the body needs about 24 to 36 hours to replenish seminal fluid. So if you're sexually active multiple times per day, or daily for several days, volume will naturally decrease. That's normal. But if the reduction persists even after rest, it's a sign worth paying attention to. Sometimes, the cause isn't frequency, it's pelvic floor dysfunction or a blockage in the ejaculatory ducts, both of which can reduce output without affecting desire or climax. So if you notice consistent changes in volume, color, or consistency, it's time to investigate, not to worry, but to understand. Several common medications can also affect semen volume: antihypertensives, SSRIs, and 5-alpha reductase inhibitors, used for hair loss or prostate issues. These drugs can interfere with hormonal signaling, reduce fluid secretion, or cause mild retrograde ejaculation when semen flows back into the bladder. Add to that constant exposure to toxins and microplastics, and it becomes clear that male reproductive health today faces enormous environmental stress. These aren't isolated issues, they're symptoms of a broader imbalance in metabolic and endocrine health. Semen isn't just a reproductive fluid. It's a metabolic fluid produced by glands that depend on your vascular, hormonal, and nutritional status. If your semen is becoming thick, sticky, yellowish, or noticeably reduced, it often means your metabolic environment is under stress, with inflammation, poor circulation, or high blood sugar playing a role. Several studies have confirmed strong links between metabolic syndrome and low semen volume. Conditions like insulin resistance, obesity, and high blood pressure impair the prostate and seminal vesicles, reducing their function. So when we talk about semen, we're really talking about the body's overall metabolic resilience. If you've noticed persistent changes in semen volume, especially alongside fatigue, low libido, urinary issues, or discomfort, it's worth seeing your doctor. Ask for a hormonal and metabolic panel, total and free testosterone, LH, FSH, prolactin, fasting glucose, HbA1c, and lipids. A prostate ultrasound or exam may also provide clarity. These tests don't just explain the symptoms, they help you prevent deeper issues like cardiovascular disease, diabetes, or hormonal collapse before they fully manifest. Reproductive health is often the first mirror of overall health. When it changes, the rest of the body often follows. The good news is much of this is reversible. Improving semen volume isn't about chasing supplements. It's about restoring your body's natural balance. Hydrate properly, sleep deeply, eat real food, move daily, manage stress, and reduce exposure to plastics and processed sugar. Even modest improvements in lifestyle can lead to better energy, mood, and reproductive function within weeks. Because your body is not broken, it's simply asking for better conditions to thrive. Decreased semen volume isn't just about aging or fertility. It's a message, your body's way of saying that something in your internal chemistry is shifting. Listen to that message early. It's not about performance. It's about longevity, vitality, and prevention. So pay attention, stay informed, and never feel ashamed of asking questions about your health. That's what awareness is for, to empower you before disease appears. I'm Dr. Rena Loeb. Thank you for joining me today. Take care of your body, and it will take care of you in every possible way. The subject is framed in a stable, static shot, with the camera held steady to create a calm and professional look. Their posture appears upright but relaxed, projecting quiet confidence and ease. They keep steady eye contact with the lens, paired with a light, consistent smile that feels approachable and positive without ever becoming exaggerated. Totally avoid describing inferred motions or actions like nodding, waving, or gesturing. Instead, describe the static position and orientation of the body, head, and limbs as they appear in the frozen frame. For example, instead of "he is nodding," describe "his head is tilted slightly forward." The description must be of a single, unmoving moment. Asterisk, asterisk. The overall performance is steady, polished, and versatile, designed to feel safe, approachable, and professional. Always lean towards conservative movement, especially with any type of head movement.